Okay, so patients come into the clinic today with a painful corn in the lateral aspect of their foot. Now, this is not the most common spot for a corn, but we do see some come in through this region. And it's mainly because the bony structure of the foot has sometimes you get a lump of bone in this section. It's either under the fifth metatarsal or the cuboid bone there. So basically what we do is go ahead and remove the callus cap, making sure not to go too deep on this one. Sometimes we get a little blood when they're a particularly deep corn, but sometimes not. We try obviously to make it as painless as possible, so the patient doesn't feel much during this. We don't need to use any anaesthetic most of the time, so we can basically just go in here and core this corn out. So we head around the outside of the hardened section. So the corn is, of course, the hard central section to the callus that we've just removed, and we call the hard central section a corn. So basically we go ahead and remove the hard section just by cutting around the barrier between the living and the dead tissue, trying not to cause too much pain to the patient and just getting it right out. We'll try and get this out all in one piece, and we'll see if we can just catch this one before it hits the ground and show it to you. But they're kind of like a translucent, almost like a beer bottle coloured piece of hard skin. So that's it there. You can see there's a little touch of blood on that one. So we've gone just slightly past the epidermal junction. So it might have stung just a little bit. Sometimes these feel a little bit sharp when we get right to the end like that. But that's how we remove a corn from the foot of the patient. Now we'll go ahead and smooth those edges up. Dress this one up because we've drawn a little bit of blood there. And then we'll review this one in probably about 4 to 6 weeks to try and remove it again, just so it doesn't grow as deeply, and we can try and make this one less painful for the patient to walk on long term.